we haven't formally discussed within our SAGE working group with other countries about why they've made their decisions. But essentially, all countries have access to the same scientific knowledge and literature on how this disease is spreading, on how other diseases spread, and on that complex physics of what happens to aerosols. And I think the differences in judgment will be based on, I suspect, expert views within those countries as to the relative importance of the different transmission mechanisms. Some countries perhaps have gone down the route of saying there is no evidence, therefore X. I think we are sensibly in a slightly more precautionary place with this. It may be over precautionary, but from what I know about how aerosols can move in the environment, I think that actually it's not over precautionary. I think particularly when you're face to face with somebody, there is certainly evidence that people within 2 meters are able to be infected.
But isn't it surprising? Science is international. The virus doesn't respect boundaries. Why would we have a kind of UK alone approach to this rather than, especially since other countries are ahead of us, learning what they do? Why would we have adopted a very different position to other countries?
I don't think it's UK alone. I mean, there are several other countries, including the US, Spain, Italy, I think Canada, Switzerland, who all have something, I wouldn't say exactly 2 meters, but around about 2 meters. Some of them say 6 feet. I think sometimes it comes down to the public health measures that you have in place in your country and the compliance with those. So you highlighted earlier that places like Singapore, Hong Kong, etc., have a lower distance. They have mandatory mask wearing, and so wearing a mask probably reduces the amount of droplets that go into the space and probably reduces the distance to which they can be projected. Now, whether this country should do that, I know it's not for me to make that decision. That would be a policy decision to make in that space. But you also have to consider whether your population will comply with a measure and comply with it properly. And I think you'll find if you go to Singapore, you'll find that people all do it and all comply, and that maybe is why they feel it is they're more confident to say that they can have a lower distance than the UK.
So it's assessing the capacity of the British public to understand more nuanced messages.
Possibly, and also I think there's an awful lot about we still don't know exactly how this disease transmits, and we are taking evidence from a raft of different scientific disciplines to try and understand this. So we're taking evidence from epidemiology, from virology, and right across fluid dynamics and engineering to try and understand what happens to this virus. Now, I don't know how other countries are making those judgments. Maybe they're making it on with a different set of expertise in the room.